Can you tell us about your journey into being interested in doing the type of work that you do?
I first became interested in this type of work in Haiti after the earthquake in 2010. I grew up in the Democratic Republic of the Congo. In 1997, there was a civil war that started, and I was really struck by the humanitarian needs that arose as a result of this conflict. And after the earthquake in Haiti, was really compelled to go and help, because at that point I was during my second year of residency and really wanted to use my medical skills. I started working at a small clinic in a large slum called Cité Soleil, and I loved the work that I was doing there and realized that that's what I wanted to do for the rest of my life. There were many people that came that had many health needs, but also spiritual needs, and we were able to not just care for them, but also meet their spiritual needs. There was a chaplain that was at the clinic that prayed with patients, and we probably treated hundreds of patients every week.
So you trained as a doctor in the States?
I trained as a doctor in the United States. I completed a residency at Johns Hopkins University in internal medicine and did a postdoctoral fellowship in clinical research at Johns Hopkins as well.
Out of all the places you've been, is there one that's touched you more than the others?
I think the Ebola response in Liberia was probably the most challenging response I've ever been part of. And that's because of the extremely high number of deaths that we experienced at the Ebola treatment unit. I would say that at the beginning of the outbreak, we were responding in July 2014, 71% of patients died. And that was extremely hard for the entire team. I think when you respond to disasters, one of the reasons why you go is to ensure that you reduce mortality and you prevent deaths. You want to save lives and alleviate suffering. I think with Ebola that was really hard to do. Number one, because patients would come in very late, and in the late stages of the illness, it's very challenging to keep someone alive. And it's hard to see an entire family die one by one, for example, or see a mother lose her child due to Ebola, and there's nothing you could have done. So I think the Ebola response was definitely the most challenging.
And how did your faith help you to deal with this trauma? 70% is a lot.
I think my faith allowed me to wake up every morning and go back to the Ebola treatment unit. It gave me the strength to continue every single day. When I think about that period of time, it reminds me of the book of Job. Every single day we receive bad news. And sometimes I questioned why God would allow such suffering, but I was reminded that He was good despite all of that. Several months after the response ended, I went back to Liberia and visited the Ebola treatment unit. And on the wall, a patient had literally written, "God is with us in here." And I think that gave me a lot of hope, to realize that God was with those patients as they were suffering.
Now you've been to Haiti, the Philippines, Greece, places where you're responding to a disaster that's finished. I suppose the only comparison would be cholera in Haiti might be the only one. You're putting yourself at risk with Ebola. Did that have an extra challenge?
I think there were definitely times where I felt exposed and there was an increased risk of contracting the illness. Having a colleague, Dr. Kent Brantley, contract Ebola really impacted the entire staff and created a lot of fear. I think a lot of the Liberian staff would ask about the effectiveness of personal protective equipment. They had been told that if they wore personal protective equipment and followed infection control procedures, the likelihood of contracting Ebola was low. So when two of our own staff, Dr. Brantley and Nancy Wrightbull, contracted Ebola, it created a lot of fear amongst the entire staff. I would personally wake up sometimes in the middle of the night thinking that I had a fever, and would check my temperature, and it was basically normal. And had nightmares for a while. I think because of how people die, the nature of the illness itself, it created fear, but at the same time, I think fear was good because it kept you on your toes and made sure that you were very strict with protocols.
So if we compare cholera coming, did that have a similar fear, or was it in Haiti?
Cholera is a different illness because once you treat cholera with fluids, whether it's oral rehydration solution or IV fluids, the risk of death goes down quite significantly. For those that receive fluids rapidly, they have less than 1% chance of actually dying from cholera. Therefore, cholera did not create the same amount of fear because there is a cure, which consists of hydration and antibiotics. I think with cholera in Haiti, the situation there was slightly different, even though it did create a little bit of fear in the population in Haiti. And it took a lot of community engagement to get families to bring their loved ones to the cholera treatment center. And this really highlights the importance of doing community engagement and social mobilization alongside what we call clinical management or case management. It's really important to integrate those interventions because you're not just treating patients, you are trying to change their behavior by getting them to seek care early.
The earthquake was devastating in itself. Because a lot of the people that I saw, and probably as you saw when they came into clinic, their homes had been destroyed. They'd already lost loved ones, or they'd been carrying injuries. And then 10 months on, they probably thought, we survived. And then to be struck down by this absurd illness. Absurd because it was brought in, it wasn't there before. Absurd because it's so easily preventable and, apart from easily treatable, but you're dealing with a social context where people's access to medical knowledge and to medical care is severely restricted and limited. So, even things like paracetamol, which we take for granted, you've got a headache, have paracetamol, they didn't necessarily have access even to the most basic of relief medication. That's sad, and it certainly concentrates the mind. And at that time, that was a baptism for me, at least into international disaster work. And therefore, yes, arriving at a time when the earthquake was added to, it had already been added to by Hurricane Thomas in November, I think it was, the outflowing of cholera. It was just crazy. It was just crazy. And created its own sense of fear because these people had never experienced anything like cholera before, with the speed with which it can take a life if care isn't applied. It's easily treatable, but if it isn't treated, it can kill very quickly.
And this was your first experience, Linda. How did you feel arriving in Haiti and this being your first time?
I was nervous. I wanted to make sure that I was going to be effective with the skills that I had. I had previously done a rotation as a resident at a hospital in the Congo, where I rounded with the internal medicine physicians. I had never been to Haiti before, and read as much as I could about the history. And as Roger was mentioning, cholera was not endemic to Haiti. It was introduced by Nepalese soldiers that were part of the UN. There is a group in Canada that was able to look at the genome of the bacteria and establish that it actually came from Nepal. I think to have individuals that are supposed to provide aid actually introduce an illness really compounded, I think made this issue a little bit more complex. And even though cholera is very easy to treat, as Roger was saying, if you don't seek treatment quickly, especially for kids, the elderly and pregnant women, your mortality rate goes up. And it's really interesting though, because access to clean water, access to latrines, basic water and sanitation and hygiene should in fact prevent cholera outbreaks. But since the introduction of cholera in Haiti in 2010, Haiti has experienced multiple spikes in cholera during the rainy season, and it will likely never go away. And they have tried to implement eradication efforts, but it's challenging when your health system is extremely weak and the government doesn't have enough resources to do so. I think prevention isn't very easily funded.
Was there a disparity in who got treatment, rich and poor, in Haiti?
I don't know that I can, as far as cholera is concerned, I can't really comment on that. I was working, I did some work in Cité Soleil, but my main base was in Bercy, which is out in the rural, so there was a lot of people who came in from the mountains and the rural countryside. As far as the quality of care provided by, and it was Samaritan's Purse that I was working with at that time also, then I would have to say that they offered, there was no discrimination whatsoever. People were brought in and people were treated as they had need. And I would imagine that would have been similar in Cité Soleil, given the demography of the place.
That's correct. Cité Soleil is a very large slum, and it's probably one of the poorest areas in Haiti. It has a lot of violence, gang violence in particular, and there are very, very few health centers in Cité Soleil. One of the reasons why access is so poor is because of the violence.
Yeah.
So Samaritan's Purse and Médecins Sans Frontières were really two of the few international organizations that were operating in Cité Soleil. And that actually increased or improved access to care.
Sure.
So for those who were coming in to be treated for cholera, were also able to access basic primary health care. So lots of people came, not just to be treated for cholera, but also to be treated for other conditions. Therefore, I don't think that access for the poor, specifically in that area, was an issue during the cholera outbreak because of the presence of a cholera treatment center.
Yeah. It is an issue in Haiti because the medical system is such that it's majority is private. I think it might be worth mentioning, and you could say something on this, in the work of Partners in Health and through Dr. Paul Farmer and others, and the establishment of the University Hospital of Mirabelais, which is in the central plateau, very near to where the actual source of the cholera outbreak took place. And Dr. Farmer, in collaboration with others in Partners in Health, set up this, and having had the privilege of visiting it and being shown around, one can only be quite agog with the state-of-the-art facilities that is there. All based, the treatment being based on the philosophy of a priority for the poor. So there's essentially free medical care, state-of-the-art medical care being provided. And that's just an indication of what can be done in Haiti, where there's a will and when there's a heart to do so. And I remember when I was there, one of my abiding memories is to see masses of people, essentially the poor rural of the area there, knowing that they may have to wait, but that they will get good clinical care and they won't have to pay for it.
So what about the hitting, the earthquake and the hurricane? There's a picture that Bob White and you use of digital comms tower next to the hospital.
Yeah.
I'm sure you've seen this picture. So that's cholera, but what about the difference in housing and those who were therefore affected by the earthquake and the hurricane?
Well, that's an interesting point, and whilst I think it must be said that there was so much damage done to buildings and therefore to inhabitants because of inefficient and inadequate construction methods, it wasn't entirely due to that. For instance, I remember making a visit to Jalousie. You know what I mean? This is an area in Port-au-Prince going up to the south, up the side of a mountain, and you just see houses almost built upon one another. And I remember walking up the rabbit runs up between them and doing some interviews there on the assumption that something terrible must have happened there as a result of the earthquake. And they said, no, many of our houses. Now, if ever you expected houses to fall apart, you would have thought it would have been those on a precipitate cliff, but they didn't. I did another interview, and I feel quite chuffed about this because it was a bit of a scoop, with the owners of the Hotel Montana, which is a very prestigious hotel, going way back into the Duvalier years. It was constructed, I think, in the 1930s by the parents of these two sisters. And not built to add it, by their own admission, clearly not built to paraseismic standards, built on 7 levels and totally collapsed. In fact, entombing one of the sisters for 5 days before she was rescued. And that was quite an eye-opener, because that was in between Delmas and Pétionville, which are quite prestigious areas. That's where the great and the grand go to live. But the hotel collapsed, and 80 of the residents were killed. Many of those from overseas. So that was quite an interesting thing. So you can't just blame it on poor quality building. It's where people choose to build, the geology and the vibration that you get through that. That's another factor which played a part. But by far, it was a quality of build. But as my research found out, a lot was made of this after the earthquake, and Bill Clinton and a number of others were trying to create, in fact they did create an exhibition of new housing, and a number of people subscribed to this, and they built examples, models of housing. And the Haitians laughed at it, quite frankly. They ended up squatting in it. They laughed at it. We can't afford that. Now, people have to live somewhere. So if you introduce building codes, which sounds great and promises a lot, people have to live somewhere. If they can't afford it, they're going to build what they can afford, unfortunately. So we're back to the root, if you like, of the issue in Haiti and a number of low-income countries, which is poverty, and those that keep them in poverty. How do you feel about that, Dom?
I think increased population density when you have camps is a big risk factor for outbreaks. And one of the reasons why the cholera outbreak ended up being the perfect storm was because you had really high population densities in cities like Port-au-Prince and in camps. There were millions of people that were internally displaced as a result of the earthquake. And when you have that high concentration of people living together and you introduce a pathogen, you know, the disease will spread very rapidly, and that's what happened. Interestingly enough, there were more individuals coming from rural areas. And I will never forget the story of a man who carried his children for 4 hours. And distance is detrimental when you're trying to access care quickly. And there are many people who weren't able to make it to these cholera clinics and died en route, or died at home because they did not have money, or the sheer determination to walk for 4 hours like this gentleman did. So yes, I think high concentrations of people living in places like camps, but also individuals that lived in rural areas were at higher risk of dying, essentially. So all of these factors really compound mortality, compound outbreaks, because of the fact that it can just rapidly spread, you know.
The reason I ask about the camps is that there was this idea that because people, when they went into camps, did get potable water brought to them in a strange way, they were safer places as far as disease is concerned than, for instance, places like Cité Soleil or other places in cities where there were these huge densely packed populations. So that there was that benefit, if you like, of the camp. That
Absolutely.
You found that?
I think because, as you mentioned, sometimes interventions are targeted.
Yes.
And camps, as you said, have potable water, they have latrines. It doesn't necessarily mean that everybody's going to use a latrines.
Well, you come back to the violence again, of course, and what could be more risky for a female in particular than having to go to the latrine in the night with absolute terror that they may be raped or worse.
Absolutely.
Before they come back.
And there was a lot of gender-based violence in those camps, and there have been reports of sexual violence. And there are guidelines that basically, guidelines in place to ensure that latrines and sources of water are placed in areas that are lighted to prevent gender-based violence. However, Cité Soleil is such a challenging place. And we actually did a couple of focus group discussions with women that attended our clinic, and those stories were horrifying. Very horrifying. There's an organization called Cofavive, and we partnered with them to ensure that we had counseling services, and we were able to refer men and women who experienced gender-based violence so that they could have access to the care they needed.
You've worked in Greece in camps. How does the refugee camp compare to one in Haiti?
Sure. So in Greece, there were many individuals that fled Syria, Afghanistan, Iraq, and it was decided that they would actually be called migrants as opposed to refugees. And these camps were actually established as transit centers. Migrants would come from Turkey on a boat, and they would land on an island, on one of the islands, stay for 1 to 2 days, get registered, and they would take their families, get in a bus, and basically drive all the way to the border, where they would then try to make it to either Macedonia or Germany. And it took a long time for those camps to have access to the services they needed. For example, during the winter, one of the interventions that we were trying to implement was actually something called winterization of shelter. It was extremely cold, and I remember hearing stories of babies that died of hypothermia. Right now, those camps still exist, and they're in very bad condition. The European Union made a deal with Turkey and asked Turkey to prevent migrants from continuing to access Greece. And unfortunately, those that were in Greece had to seek asylum. And it's been very controversial. However, the conditions of these camps were extremely poor. I remember one of the largest camps on the island of Lesbos was called Moria, and it was devastating to see children, having to play in those conditions. UNHCR worked with Samaritan's Purse to improve the condition of the camp, but it took a long time to get that done. And it was hard to see the desperation amongst the migrants/refugees that were arriving. They left everything they had in Syria to flee the war, sometimes leaving family members because they couldn't afford to bring them to Greece, not knowing where they were going, not knowing what would happen to them. And Syria used to be a middle-income country where you had a lot of professionals, and I would encounter physicians and engineers that just didn't know what they were going to be doing, and they had a life before they left Syria, and all of a sudden they lost everything. So you see that same sense of despair. You see that same sense of wanting answers and needing basic things like food, water, clothes. These are basic things that everybody should have access to, and there's no reason why in this day and age access to food or water should be a challenge. We have too many resources. However, it's still a problem. You see people fleeing because of war. There's been a conflict in Syria for 7 years, conflict in Iraq, Afghanistan, and yet the needs that people have are still the same. I think after a disaster, whether it's a natural disaster or conflict.
Mm-hmm.
And how were the local people, when obviously because in Haiti, these are local, that's where they've come from. What was the reaction of the Greek people?
The reaction of the Greek people was a little bit mixed. There were Greeks that were very open and welcome, and they welcomed people with open arms. One of the managers of a camp that I worked at decided that he did not want to call it a camp. He wanted to call it a hotel, because he wanted to ensure that everybody who came experienced Greek hospitality. and we weren't allowed to call them refugees or migrants.
Mm-hmm.
He made that very clear. And it was an amazing place.
Mm.
But in contrast, there was a lot of xenophobia that was demonstrated in a lot of Greeks. And because Greece experienced an economic crisis, a lot of residents did not want to help others that were in need. It was very complex. And yet I saw many, many Greeks who worked for Samaritan's Purse, for example, and they decided, I want to help you because I'm a Christian, and that's my call, my calling. It's my calling to serve. So the reaction was very mixed, but I was extremely impressed with those that did rise up to the challenge and that did help these migrants or refugees that came to Greece.
Do you want to talk about the Philippines? Have you both been there, haven't you? So.
Yes, you were at Tacloban?
I was in Tacloban.
Yeah. Which was the worst affected area in turn because of the tidal surge. I was on Bantian Island. Tacloban, if you're looking at a map of the Philippines, is to the right of the island of Cebu. Bantian Island is on the top, just off the top left tip. Bantian Island did not suffer anything like the loss of life that you incurred in Tacloban, and probably similarly not the same level of, certainly of urban decimation. But the typhoon went right through the island, and typhoons don't just go through once, they go through and then they come back again. So there was a huge amount of material damage and a huge amount of fear and some loss of life. So it would have been different working in the two locations with different challenges. The one crossover point, if you like, from the interviews I did on Bantian Island was that the Bantian Islanders were terrified of Tacloban because of the reports of looting and rampages, and there were a number of people who said, well, we were really afraid because we heard they were coming our way. But the majority of the damage was material, structural, livelihood, and also that had an economic knock-on effect to the lives of people on the island, and environmental as well. And the fear, as it were, that goes with that. But it would have been different for you.
I think there was a lot of structural damage. Homes were destroyed, hospitals were destroyed. I would just like to touch on the emotional distress that I was able to witness among patients that I cared for. And it was very evident that many experienced emotional trauma as a result of the typhoon. And it was very challenging dealing with it because on one hand, there is a medical treatment for anxiety, but access to medication after such an event becomes extremely challenging because of the disruption of health services. And yet, interestingly enough, the Filipino nurses that came to work every day came in with a smile on their face. And their clothes were ironed, they looked amazing. And I think there's a lot of resilience that's developed, that's maintained after a crisis, and they were really able to exhibit that. I went to a service, and the service was actually on the porch of somebody's house because their church building had been completely destroyed. And the pastor's son told me a story. And he described how the entire family thought they would die because the water came up to their head, essentially. And his father, who's a pastor, said, "Son, I want you to praise God." And he thought to himself, why should I be praising God in this circumstance? And he said, "You're alive, aren't you?" And I realized then, and through many other experiences, that we are still, if you're still able to praise God because you're alive, I think that's a great demonstration of faith. And sometimes we need to go through suffering to realize how much we need to rely on God.
I would echo that from a number of, all the areas in which I've done research work. Many of those who owned a faith would say precisely the same. The learning curve that they went through. They wouldn't want to go through it again, but they're grateful for what they could learn from what they did go through.
I just thought of a story from Haiti. There was a woman who participated in a focus group discussion. And as we were conducting the focus group discussion, she mentioned something that was very profound. The group consisted of 4 or 5 women, and they had at least 3 to 4 children each. And she looked at us
Only
and said,
3 to 4.
She looked at us and said, all of these children are a product of rape. And that was quite astounding, and it was horrendous. And we asked them, how do you do it? How do you survive if that's your life, your everyday life? And she said, because of God. And we have each other.
Yeah.
And I could not imagine having to live that life. And yet, if you saw her walking on the street, you would have no idea of what she has to experience as a woman living in Cité Soleil. I'm reminded of a quote that says, hold everything loosely because God can take it away from you. And I think that lesson is definitely learned through struggle and suffering. If everything is taken away from you over and over, you're not as attached because I think you value life a lot more. And joy should not be linked to your circumstance. It should come from God. And I think because we tend to have so much around us, we think that our joy or happiness should be linked to those material things because we live in such a materialistic environment. But joy should come from God.
Sure. But what about viruses? What about the children you've seen and who died from Ebola? How do you explain that?
That's extremely challenging to explain. One of the most painful memories I have is that of a mother whose child was admitted to the Ebola treatment unit that we were managing. And she would come see him every day. And I remember her looking at me and saying, please, please, please save my son. Don't let him die. He's my only son. And he died 2 weeks later. I was extremely devastated. And I could not quite understand why God allowed such a thing to happen. It took me months to get over that. But I think that event motivated me to go back to West Africa and to prevent further deaths. And I think our reaction to suffering can either be to realize that God wants us to respond by by alleviating suffering, because he has created many different professions, whether it's medicine, law, clergy, etc. We are all called to respond to suffering. I don't quite understand why suffering occurs. I do know that we are mandated by Christ to alleviate suffering. Viruses are very interesting because they tend to mutate quite a bit.
Sure.
The World Health Organization just created a list of 10 pathogens that we should be focusing on. And pathogen number 10 is called disease X.
The next one.
So we don't know what it's going to be.
But it's going to come.
But it's going to come, and there might not be a cure. And there might be a delay in finding a cure or a vaccine. And yet, we still have to respond. We still have to prevent deaths. I was extremely fascinated by a team of researchers that I met recently. I visited the National Laboratory in Manitoba, Canada, where researchers had worked on a drug called CMAP for more than 10 years. And unfortunately, they had lost funding. The drug went into what's called the Valley of Death, meaning it was shelved.
Sure.
Until the outbreak in West Africa in 2014. And my team was able to administer this drug to 2 of our colleagues. And that drug was revived, and it was actually studied in a clinical trial. So even though these viruses can be deadly and take away many lives, I think our response to that is to do research, provide clinical care, pray with folks that are suffering from it, be compassionate.
Sure.
So I don't have an answer to your question on why suffering exists, but I do know what our response should be to suffering.